Hi everyone, this is Dr. Israel James, and I am here to share my story as a male nurse. Alright. So, as you all know, on this channel, I started by being a nurse and then I transitioned to medicine. And I'm here to share a little bit of my experience with that. First thing is this. What does it feel like being a male nurse in Africa? Well, very interesting. There's a lot of pressure on you and all of that, but I believe it's really changing. Times have really changed. Now, some of this experience I'm sharing happened about 8, 9, 10 years ago, maybe 11 years ago, yeah. So, first of all, I believe there's a stereotype about being a male nurse. I'm not sure where that came from or why that is the way it is, but then, I don't know, there's something that looks like, or that makes it look like a guy cannot be a nurse. I'm not sure, maybe because the mother of modern nursing is Florence Nightingale, a lady, so probably that's why that they feel that a guy can't be a nurse. I don't know, but in the African setting, there's this connotation that has to do with ladies and being nurses. I think in Nigeria the first nurse was was a woman, and I think also the first registered African nurse, I think she's South African, yeah, was a lady. So I believe that there is that stereotype that nursing is mostly for ladies, while medicine and being a doctor is like it's a manly thing, like macho. Anyway, but then with that experience, but then when I got into nursing school, I realized that, oh wow, there were a lot of guys in my class, and I was like, well, first of all, that was quite comforting. And then and then I started having a lot of experience while in the hospital, going on internships, and then for the little period while I worked. And then for me, my personal experience, it wasn't so great because I had quite a lot of ups and downs. I remember vividly one scenario where the doctor who normally handles the ward, I think I was in the medical ward, yeah, and then he usually comes for the shift, but then he wasn't available that day, so someone had to substitute for him and the doctor. And then this doctor walked in, and then he sees me with my scrubs and then my white coat, and then he goes like, I'm not going, who is this guy? Is he a medical student? No. Oh, he's one of the nursing students here on internship. You know what? This guy has to get out before I do my rounds. And then the nurses try to understand what is happening. The matron tries to understand, talking to me, what is wrong with what he's wearing? It's like, no, he looks like he's a fellow doctor. And for over 30-45 minutes, the guy said he wasn't going to do his job, and then he walked out. He went back to his office. Very interesting. And then the matron calls me to the side, and then she tries to talk to me, and she's like, you know what, just don't worry about this. You have to sit out today's rounds, because I know you don't have anything else to wear, so you have to sit this out so that we can take care of the patient. Yeah, of course, I sat out on that day. The doctor comes back, he takes care of the patients, he goes from one place, from one patient to the other, and then when he's done with them, and I'm sitting in one of the rooms, I'm like, oh my god. And well, don't worry. Yeah, to some extent it foiled my desire also to go ahead and push for medicine, but then prior to that, I already wanted to be a doctor. Nursing was what was available at that time, so I had to first of all go with that. Yeah, so that's one of my experience, and then I don't know why he felt that way. But then I also came across a couple of doctors who really felt, I don't know, maybe because I'm tall, maybe because I'm looking weak, I don't know. But literally, they were not really comfortable with me being around as a male nurse. They preferred working with the ladies and all of that. But then, also looking at it from the point of the patients, or from the point of the ones who are sick, who actually need the help with their health. Most times there's this notion, which I don't also believe in, and the notion is that female nurses turn out to be wicked, or female nurses are wicked. Well, so it makes it that whenever they see a male nurse, they go ahead and then they get close to him, and then they, most times they want him to be the one taking care of them. I believe. I'm not sure why. Now, mind you, I'm saying this in the African setting. In the African setting, let's be precise. Yeah, I understand that people have had quite a lot of bad experience with nurses, female nurses, and all of that. But then, I don't believe in that notion. A nurse is very empathic. They do their job how they have to do it, and yeah. So, male, female, they are quite amazing. They do a great job, and then big up to the nurses. Without the nurses, the doctors are going to be a total mess. Now, coming to one of the experience I had a couple of female nurses I was working with. And there were patients who they will not allow anyone else take care of them, give them their drugs, injections, do anything, if not me, And then for them it was, and I was like, one time I bothered asking one, they were like, oh, well, you look like a doctor and everything. And funny enough, initially they believed I was the doctor till I was like, oh no, I'm not, I'm not a doctor. I'm a nurse. I just happen to be a male nurse. And we're like, wow, really, you know, at first they didn't even believe me, and then from time to time they got to joke about it, and then finally they were, oh, I need that male nurse that, you know, to come and do one or two things for me. And yeah, so that is a little bit of my experience, and I'm pretty sure that there are a couple of people who are out there who are experiencing this, and of course, many nurses, many patients, they kept on telling me, you are going to make an amazing doctor. Well, here I am today. I'm a doctor. I don't know if I'm amazing. Am I amazing? Maybe I will allow you guys to be the judge of that. Well, until the next time I see you on this channel, have an amazing time, and remember to do what? To subscribe, and also turn on the notification bell. Where is it? Left or right? I don't know, but wherever you see it, click on that so that you can get updated every time we post a video. See you next time. Bye bye.